Hi everyone. Today we are going to do tracheostomy care on a patient. So first we will gather our equipments. Our equipments are disposable gloves, sterile gloves, goggles and mask or face shield, additional PPEs as indicated. We will have a sterile pack, as you see there in blue, which will consist of sterile normal saline, a sterile cup, sterile cotton, sterile gauze, and disposable inner tracheostomy cannula will be on your patient, sterile suction catheter and glove set, plastic disposable bag, which will be in your bin, and a nurse if you need. So now we'll carry on to the actual procedure. You will bring all the necessary equipment to your bedside, stand or over bed table, perform hand hygiene and put on the PPEs if indicated.
I already washed my hand at the sink, but I would go to use some antibacterial sanitizer as well.
PPEs are being placed on. Identify the patient.
Good morning, sir. My name is Nurse Sant. I have come to do a cleaning of your tracheostomy catheter, right? I just want to verify your name. So I'll have a look at your name tag, okay? So, Joe Black, Joe Black. All right, so we know we have the correct patient, all right?
Close curtain around bed and close doors.
I've already screened your environment to provide you with some privacy, okay?
Determine the need for tracheostomy care. Assess patient's pain and administer pain medication if indicated.
All right, well, I'm having a look at your tracheostomy and I see that it is a little bit untidy. And I looked at your notes and it has not been cleaned since yesterday. And there's some sputum observed on the dressing. So we will clean that for you, right? Are you having any pain? If you're having any pain, can you squeeze my hand? Squeeze my hand if you're having pain. Okay, so you seem to not have any pain. If you had any pain, I would have gotten some medication before we start for you, all right?
Explain what you are going to do and the reason to the patient, even if the patient does not appear to be alert.
All right, so Mr. Black, as I said, your tracheostomy catheter, it needs some cleaning around the area in order to maintain sterility. So we want to do that because we don't want you to get an infection in the tracheostomy. All right? You understand what I'm saying? Okay, here, squeezing my hand, very good.
Reassure patient you will interrupt procedure if he or she indicates respiratory difficulties.
All right, so I know you won't be able to talk right now, but anytime during the procedure, if you feel that it is uncomfortable, I want you to blink or close your eye very tightly for more than 1 second for me, and I will know that you're having some challenges and I will stop.
Adjust bed to comfortable working position, usually elbow height of the caregiver.
All right, so I fix the bed a little bit for my comfort, for me to work better, all right?
Lower side rails closest to you.
All right, I'll lower the side rails.
If patient is conscious, place him or her in a semi-fowler's position.
All right, so as I adjusted the bed as well, I know by looking at your oxygen saturation, I know that you're getting adequate oxygen in the position that you're in, all right?
If patient is unconscious, place him or her in a lateral position facing you.
Well, I know you're very conscious, Mr. Black.
Move the overbed table close to your work area and raise to waist height. Place a trash bin within easy reach of work area. Put on face shield or goggles or mask. Suction tracheostomy if necessary.
Okay, I'm again looking at your SpO2 and your respiratory rate and your capillary refill. I realize that you don't need to be suction at present, so we will skip that part.
Carefully open the package with the new disposable inner cannula, taking care not to contaminate the cannula or the inside of the package.
All right, so Mr. Black, we're not going to change the inner cannula today. As I said before, we're just going to clean around your dressing because that's all that's required, all right?
Put on disposable gloves. Remove dirty dressing by dirty nurse. Sterile nurse prepare a sterile package. You would drape your patient. You would pour your normal saline. Before we pour our normal saline, we would have obviously checked our bag, making sure it is normal saline and the expiry date, and there is no sediments in the bag. So now our sterile field has been set. We would remove our oxygen source if necessary.
There's no need to remove the oxygen source.
Remember, your patient SpO2 would have been monitored at this point.
It's within normal limits at 97.
You would dip your cotton tip applicator or gauze sponge in a cup or basin with saline and clean the stoma under the face plate. Use each applicator or sponge only once, moving from stoma site outwards. Make sure that the skin area is dry. During this time, we can speak to our patient, making sure they are comfortable and not in any pain.
I see that you're not closing your eye tightly, so that means that you're comfortable.
You would slide the commercial prepared tracheostomy dressings. If you do not have a prepared one or a tracheostomy kit, you can take a piece of gauze, use a sterile blade and cut it downwards. So you will have a half of an opening. You would then place it under the faceplate. Good. You'll make sure that your patient is comfortable with it.
SpO2 is being maintained. Patient is showing no signs of distress.
You would then remove your gloves and assist the patient to a comfortable position, raising the bed rails and place the bed in the lowest position.
I'm going to lift the rails up, all right?
We would remove our face shields, or goggles and mask, and additional PPEs, then perform hand hygiene.
These are to be disposed of and sanitization done. Right? My patient's SpO2 remains between 97 and 98. Right? Are you having any problem, Mr. Black? Okay, no problem. Patient respiratory rate stays within normal. It's at 20. There's no pursed lip breathing, or there's no use of accessory muscle, and there's no discoloration.
That is the end of tracheostomy care. Thank you.